Hello, my name is Michelle Halligan Foley, and I am the Safe School Healthy Students Grant Director here in Rochester, New Hampshire. MTSS-B, Multi-Tiered System of Support for Behavior, has evolved over the last 4 years in Rochester. In our district, we look at MTSS-B in 4 ways: organizing our evidence-based practices, improving implementation of those practices, using data to guide decision making, and maximize our academic and social behavior outcomes for students. We look at 3 tiers in MTSS-B. Tier 1 is our school-wide universal level for all students. Our focus is on prevention by promoting pro-social and healthy behaviors for all students. School-wide expectations and routines are taught. In Rochester, students learn through practices of rollouts. Classrooms are using responsive classroom and mindfulness as a few examples. Tier 2 is more of targeted interventions and supports that address social, emotional, and academic skills and aims to promote social, emotional, and academic achievement for students who are non-responsive to Tier 1 and supports. In Rochester, schools are doing screenings as well as viewing multiple sources of data: ODRs, academic progress, attendance, teacher, family, student nominations to identify students who require Tier 2 supports. We are focusing on interventions such as friendship groups, anxiety groups, mentoring programs, sensory groups, skill streaming, check-in, check-out, coping cat, zones of regulation, and peaceful alternatives to tough situations. Tier 3 are for those students who are non-responsive to Tier 1 and 2 interventions and supports and who need more intensive and comprehensive supports. In Rochester, this focuses on individual student support plans that are designed, implemented, monitored, and adapted to meet the needs of each student. Interventions in this level include Renew and LSCI. Our goal in Rochester is to establish and maintain effective teaching and learning environments that have a common vision and outcome, language, experience, or routine. In Rochester, we have 11 schools with over 4,500 students. This framework has been important to create a comprehensive approach to student wellness as well as meet the needs in the community. It was very important to develop a district-wide leadership team to oversee the implementation of the strategic plan, so multi-site school training, resources, and implementation occurs. This is difficult because all 11 schools are at different levels of implementation. Our district leadership consists of administrators, teachers, paraeducators, external coaches, and our mental health community partners. Our district leadership oversees coaches training, our MTSS-B website library for all staff, on-site school support pre-K to grade 12, and district-wide training for universal and target teams. My advice when starting this journey: I believe that a district must understand the umbrella of MTSS-B and implementation science before they begin. They need to do a tiered fidelity inventory to find out where their schools are and then sit down at the district level and come up with a plan. Be patient. Implementation and high performance takes time. It's not going to happen overnight.